You're listening to Simple Health Radio, the podcast about recognizing medical emergencies and promoting wellness. Your host is Dr. Emron, an experienced ER physician who has treated thousands of people just like you. Information on the show is not a substitute for professional medical advice. Always talk to your doctor or go to the nearest emergency room with any questions you may have.
Thank you for joining me on today's episode of Simple Health Radio. I'm your host, Dr. Emron. On today's episode, we'll talk about the case of a young lady I met about a month ago. She was about 25 years old, healthy, and we'll call her Annie. Annie came into the ER because she was having pelvic pain. She was having some discharge, and she had a little bit of odor. She had no fever, no vomiting, but it had been going on for several days, and she had a new boyfriend, so she was worried that she had developed an infection or an STD. Now, in the ER, our standard tests include a urine pregnancy test, which was negative for her. We did a urinalysis, which was also negative, and we sent out the cultures for gonorrhea and chlamydia, which were still pending. And then a few minutes later, I received a call from the laboratory, and they told me that the patient had Trichomoniasis, and that's what we're going to talk about today. So Trichomoniasis is an STD. It's actually the most common non-virus STD in the world. Women are much more affected than men. There's an estimate that 3 times the number of women will have Trichomoniasis as compared to men. Trichomoniasis is actually a parasite. The medical term is a protozoa. So basically, this is not a virus. It's a parasite, and it only lives in humans. So it can only go from men to women, women to men, or any combination thereof. What happens is the parasite lives in the vaginal area or the urethra, which is where people urinate from, but it can also become invasive. It can go deeper into the body, such as the bladder. It can go to the uterus. It can also go to the prostate. Because it's a protozoa, it wants to multiply. It's going to make more copies of itself, and that's actually where the discharge that most people develop comes from. Now, some people may not have any symptoms at all, meaning they won't have any fever, they won't have any burning with urination, they won't have any odor, and so this infection can actually hide for a very long time, months or even years before people realize that they have it. Sometimes it's found by accident. So when a woman goes for just an annual wellness exam, like a well woman exam, and her doctor does a pap smear, she will actually be able to detect it. And in those cases, she'll need treatment right away, and then her partner will also need to be treated. Now, because this is a parasite, we use antibiotics to cure it. The most common one is called metronidazole. It comes in a pill form, which is also called Flagyl. It also comes in a cream form, which is also called Metrogel. The pill is generally more effective, but the cream is available for some people. In cases where this may be resistant, there are other formulations of medication that can also be used, but the Metrogel or the metronidazole are very effective. Now, it's estimated that in the United States, over 5% of women may be carriers, meaning they may have it and have no symptoms whatsoever. The highest prevalence is actually in Black women or African American women in the United States. Up to 13% of these people may have trichomoniasis. Now, men are also infected, as we mentioned. Their symptoms may be a little bit different, and they may not have any symptoms at all. And it's estimated that up to 5% of American men actually have trichomoniasis. So if we do the math for just a minute, there's about 300 million Americans. If we exclude all the children and just look at the adults between the ages of 18 and maybe 55, you're talking about probably 60 or 70 million people that could be exposed. And out of there, if you do the breakdown, we're talking about at least 1 million to 2 million people a year who may have trichomoniasis. So that is why this is the most common non-virus STD worldwide and definitely in the United States. Now, the treatment, which we alluded to earlier, is the antibiotic. The key, though, is to treat both partners at the same time, because if you only treat one person, for example, the female, and you don't treat the male, they're going to share it back and forth, and then they're both going to come back frustrated and see the doctor several weeks later. Now, it is possible for a pregnant woman to have this infection and give it to her newborn infant, and that's what we're trying to avoid, and that's why the doctor or the gynecologist will always screen for these types of infections at the initial visit, which is with the pelvic exam pap smear, and also on the urine test. Now, if you remember, I mentioned that the lab called me to tell me that they had detected the trichomoniasis. The reason is that the urine sample, when they look at it under a microscope, you can actually see this parasite moving. It has 4 flagella. Flagella are tails. So it looks like a round object with 4 tails and almost like it's waving or swimming around. It has very fast movements. It's very, very rapid sort of oscillation. And so on the microscope, whenever we see it, and if I have a medical student or a nursing student, I will grab them and say, look, take a look in the microscope and tell me what you see. And they're always shocked because they see something moving around very rapidly, almost like it's waving to you. So that is Trichomonas. That is the STD, and that's how it's confirmed, which is on visual inspection. Now, the other testing that can be done is RNA or DNA testing. There's some PCR testing. Those are typically used for other types of specialized cultures if necessary, but a majority of these are just handled by simple urinalysis or pap smear test, and then this can be looked at under a microscope. Now, all partners need to be treated, as we mentioned, so there's no time limit, meaning the person could have been exposed a week ago. It could happen a year ago. So any partners during that time that may have had intercourse or had been exposed, all of them need to be notified either by phone call or text message so that they can take the medication, treat it, and be done with it. This is a fully curable STD. We're very lucky that we can fully cure this as compared to other diseases that are not curable, such as HIV or herpes. Now, let's say a woman decides not to have her infection treated or she's not taking her medication and she's pregnant. That is linked with preterm labor. So anything that we can do to avoid preterm labor is always going to be beneficial to the mother and the child, and that's why we always screen for that whenever possible. Now, if you remember again earlier, we talked about the patient Annie who had come to the ER. I advised her that she had trichomonas. She was a little bit surprised, but I explained to her all the information, which I just explained to you. She took her medication. I called her a week later, and she was doing just fine. Her partner was tested and treated, and everything was good. So there were no long-term issues, but I'm glad that she came when she did so that we could alleviate her symptoms and hopefully prevent the transmission of this STD going forward. Now, if you have any questions about trichomonas or if you have other experiences with it, please let us know. We have a very active Instagram page. You can share any details, or if you have numbers of free STD clinics, or if you have information that may benefit our listeners, please share it with us, and I'll be sure that we discuss it on a future episode. Thank you so much for listening to today's episode, and I hope to have you back on the show again soon.
We hope you enjoyed this week's episode. Visit simplehealthradio.com to read the blog, follow links mentioned on this episode, and easily share content with your family and friends. Subscribe to the show on iTunes, Spotify, YouTube, Spreaker, iHeartRadio, and the 3 and Out Radio Network. Be sure to connect with Dr. Emron on Twitter, Facebook, Instagram, Pinterest, and Tumblr to send us your questions and ideas.